Thank you, Madam Chair. Ms. Todman, would you agree that if you try to make repairs to your home after 20 years of neglect, it would be much more expensive to repair at the end of that 20 years than if you just invest in routine maintenance?
Agreed, and my testimony speaks to that, and there's a chart that shows sort of the longitudinal impact of non-investment in the past several decades.
And Ms. Yentel, would you say that public housing is part of our national infrastructure?
Yes, absolutely.
Well, for more than 2 decades, the federal government neglected to make the New York City Housing Authority's developments. They failed to invest in them for more than 400,000 New Yorkers. And so now we have about 2 decades of complete neglect. And that bill for 2 decades of neglect is a lot bigger than if we had just invested in that routine maintenance. Would you agree with that, Ms. Yentel, Ms. Todman?
I agree.
Yes, agreed.
So, people say the term they'll just throw out the term $32 billion. That is what is owed to New York City's Housing Authority alone, $32 billion. But what does that $32 billion in neglect look like? Well, we took up some stories from our district, and it seems this is what that $32 billion in neglect looks like. In one apartment in the Bronx, sewage flows into an apartment when it rains and water leaks through the roof. Children like Michaela Bonaparte have blood lead levels hitting 8 times the amount that prompts health department action. 800 children under the age of 6 living in NYCHA housing tested positive for high levels of lead between 2012 and 2016 during the federal disinvestment period. While already in decay, Hurricane Sandy devastated many housing developments whose boilers were located in the basement, and they already continue to struggle with that replacement. During the winter, residents have to open their gas ovens to heat their apartments because the disinvestment has prevented and tied the Housing Authority from being able to replace these heating systems. People are going without hot water and heating during the winter time. In some cases, residents estimate heat in their apartments began to falter over 10 years ago, and they have to make do with space heaters in the middle of winter. Other residents have to put up with the stench of pervasive mold that triggers their asthma. Madam Chair, I seek unanimous consent to submit to the record multiple articles from the New York Times highlighting each and every one of these cases.
Without objection, such is the order.
Thank you so much. Ms. Yentel, do you believe that all of these horrific cases were necessary, or were they unnecessary in terms of the government's disinvestment?
There's certainly, those kind of health consequences are unnecessary and shameful and a direct result of disinvestment over decades into the repairs necessary to upkeep those homes.
So it was completely unnecessary for these kids to get lead in their blood. It was completely unnecessary for these families to live through winter without heat. It was completely unnecessary for these families and children to breathe in mold. And we did it anyway because we decided that their lives and that their housing was not worthy of federal investment. Would you say that's correct?
I would. I'd say that the funding that is required to keep those homes at a decent, safe level have been underfunded for decades. Funding for public housing repairs to repair all of those units that you're talking about were cut in half over the years 2000 to 2016 and continue to be terribly underfunded compared to the need.
So this is what we did.
Fixable.
And,
it's all fixable.
And thank you. And as we said that as people made excuses that these investments were unaffordable and that there was no money, we exploded our military budget, we expanded fossil fuel subsidies to oil and gas companies, and we continued to provide tax cuts to corporations and the exceedingly wealthy that didn't need them. Yet at the same time, folks have the audacity to say that there's no money for public housing and that that we can't afford for children to have clean blood and clean water. I mean, this is morally wrong, and it's also fiscally unnecessary. I have one last question. As we transition to the necessity of green and clean energy, Are there health benefits that are possible here? Can we create jobs for folks in housing, that are living in housing authority as we make that transition?
Certainly. I mean, the Section 3 program is one that, as we look at the capital fund as the tool, many housing authorities will use Section 3 as a way to employ residents, but also there's
Time has expired.
Thank you.